Hi, my name is Feng. Today I am going to show you a video of how I teach the patient before the patient's going to the operation room regarding diaphragmatic breathing, how to use incentive spirometer, how to do a half coughing, and how to do control coughing, how to turn in bed, and how to do leg exercise. So it is very important that we do all this patient education before the surgical procedure and to participate so the patient can have active recovery without much complications. So first I need to gather my supplies. For this exercise, I am gonna need a pillow and then a stethoscope, and I'm going to assume that this is incentive spirometer, and then also a positive expiratory pressure equipment, and then maybe alcohol swipe, and then so now I am going to go to the patient's room and proceed with patient teaching. But first, I want to perform hand hygiene, and I'm going to knock the patient's door. And as I get in, I'm going to close the door or close the drape to provide patient privacy. I am going to introduce myself. Hi, Mr. Smith. My name is Nurse Feng. How are you doing today? So he's alert and oriented, and he is in ready to be receive patient education. And before I do that, I want to make sure the family, if there are any, and caregivers are also around and present for the education, because they are also maybe participating during the post-operative care when the patient is recovering. So if the families are here, I'm going to have them here also. And today I'm going to give you teaching about some exercise to help you breathe better, prevent some respiratory complications after the surgery. Is that okay? So the patient says, okay. Do you have any pain right now? And he said no pain. So there is no barrier for teaching. And so first I'm going to identify the patient's name. So can you please tell me your name? So he said his name is Mr. Smith, and I'm going to go ahead and look at his armband. So the armband does says his name, and then his birthday is correct, and I look at his medical record also, and they are verified that he is who he is. So I will go ahead and do a respiratory assessment on his lung, because I need to make sure that he doesn't have any lung problem before the surgery. So I'm going to go ahead and do a auscultation. So I'm going to listen to all the lobes of the lung, on the upper, the middle, the bottom, and then the lateral. Okay, and then I'm going to listen to the back. Then listen to the heart sound, bowel sound. So it seems like the lung sounds are clear in all lobes, and then the hearts are regular and strong. The bowel sounds are regular also, and so he doesn't have any complication today. And I also wanted to ask him, does he have any history of such as chronic bronchitis, asthma? Does he check for any obesity, any smoking history? So if there's anything that I will let the doctor know, and then they will be prepared. And So now it is very important that before I teach, I need to make sure the patient is able to do deep breathing and cough effectively. So I need to assess that. So I'm going to place my hand on the patient's abdomen and then let the patient do a deep breathing first. And then I will ask the patient to cough into a tissue after the deep breathing. So Mrs. Smith, so I'm going to assess your ability to cough and then do a deep breathing. So while is it okay I put my hand on your abdomen? So is it okay? So he said okay. So can you, when I put my hand on your abdomen, so you can do that to yourself also. Please deep breathe through your abdomen. Does it feel okay? So he seems to be able to do that. And then can you cough for me? So he coughed. There is no difficulty. So I'm going to go ahead and proceed with my teaching. Now, I'm going to teach the patient how to do a diaphragmatic breathing. To do that, Mr. Smith, please make sure you sit on after the surgery, when you do a diaphragmatic breathing, make sure please sit on a chair up high, and then you need to have your palm along the border of the rib cage, and then with the other hand overlap slightly, and then so the tip of the third finger touching slightly, and then so that's how you would do it. Okay, so he's demonstrating the skills, and he is verbalizing understanding. And so when you do that, while your hand on your covering your rib cage, you should take a slow and deep breath and inhale through your nose, and then at the same time you should push your hand against your abdomen, and then you will feel the normal downward movement of the diaphragm during inhalation. And then now remember, when you do that, make sure that you're breathing with your abdomen, not your chest. So really suck into the abdomen and push your hand against it. And as you're doing deep breathing, and you can hold it for count of 3. So 1, 2, 3, and then slowly exhale through your mouth, through your pursed lips, like this. Right, like blowing out a candle. You can do this 3 to 5 times, and then you can practice this exercise. Do 10 slow and deep breaths every hour when you're awake and throughout your post-operative period. So that was the diaphragmatic breathing. Next, I'm going to teach you how to do the incentive spirometer. So what it is like you will see a tube, like there will be a tube, and then there will be a little piston, a ball inside, and then there are markers showing you where the levels are, and then there's a hose and there's a mouthpiece. So what you do is you would sit up again, and then you would hold the incentive spirometer on your eye level. And if you had a surgery on your abdomen, you can hold the pillow on your incision to splint it, so while you do the incentive spirometer, so that will decrease the pain at your incision side. So assuming that this is the mouthpiece, so that connecting to the spirometer, so you will put the mouthpiece in your mouth, and then you close your lips tightly around it. You slowly breathe out, exhale completely. And then you breathe in slowly again, as deep as you can. Right? And then As you're doing that, you can see the piston rise. It will be the little round ball will be going up as you're inhaling, and then it means that you're doing it right, right? And then as you're inhaling, you're gonna hold your breath for 10 seconds, as long as possible, and then as the little ball is gonna drop as you hold, and then as when you see the little ball reach the bottom of the spirometer, yeah, you can breathe out slowly through your mouth. And rest for a few seconds. You can repeat that for 10 times, and after 10 times, try coughing, right? And then when you cough, if you have an incision, spoon the pillow on your incision area and cough. Deep cough, right? And then when you cough, it will help loosen up your mucus in your lungs, so that help clears your lung. So it helps that as you're doing the exercise, you can see how where the little round ball get up to which level. Usually, you can mark it, so that is your level. So as you're practicing the next time, you can see if that's your goal to at least reach it, or if not pass it the next time. If you go past it, it means that you're inhaling more forcefully, so you're doing a good job. So while you're awake, you should repeat that every hour. Next, I'm going to teach you how to do the positive expiratory pressure therapy. It's also called huff coughing. And again, you're gonna sit on your semi-fallow position, like sitting up in a chair. And then if you have a nose clip, you can clip your nose, and then you will again, I'm going to assume that this is the device. It's called the PEP, short for PEP device. You're going to put that in my mouth, and then with my lips closing the mouthpiece, and take a full breath and exhale. Now be mindful that the exhalation should be 2 or 3 times longer than the inhalation. Right? Slowly through your mouth, and then you should repeat that 10 to 20 breaths. And then as you remove the device from your mouth, take a slow and deep breath. And hold it for 3 seconds like I just did. And then after you did that, you're going to quickly exhale and forcefully and short, like this. So does it make sense to you? So the patient, I'm going to ask the patient to demonstrate. So the patient is able to verbalize understanding, and then demonstrating your skills. So it seems that he's understanding it. So next, I'm going to teach the patient how to do controlled coughing. Again, for this exercise, you should sit up at the upright position. You're going to do 2 slow and deep breathing. Inhale through the nose and exhale through the pursed lips. So when you inhale deeply the 3rd time, you should hold your breath like this. And I count up 3. 1, 2, 3. And then cough 2 to 3 times in a row without inhaling. So you deep breathe and you hold it for about 3 seconds, and then cough 3 times without inhaling. So this will help you push the air out of the lung. So again, you should know the difference between coughing through your throat and the difference between coughing deeply to your lung and the abdomen. So try to use the diaphragmatic coughing like this, right? So again, if you have incision in your abdomen, make sure you splint it with the pillow, so that will help decrease the pain and your incision level. Does it make sense? So he's saying that it does make sense, and he's demonstrating the skills. So that's very good. And he should cough 2 to 3 times every hour when you're awake. And when you cough, if you do have sputum, please make sure to examine the consistency, the odor, the amount, and the color changes between each sputum. If you notice any changes, please let the nurse know. Okay, does it make sense? So he's saying yes, and then he asks questions, and that's good. Give me answers. And now I'm going to teach him how to turn in the bed. For this, I'm going to demonstrate how to turn toward the right side of the bed. So it is likely that you will be in pain. You'll be maybe stay in the bed for maybe for a little while you're in bed. Maybe the first day, you will, if you want to turn to the right side, so most of the effort will be on the left side to propel yourself toward the right side. So that is the opposite. If you want to turn to the left side, your effort will be on the left side to turn toward the right side, right? So again, if you want to turn toward the right side, you should move yourself toward the left side of the bed, and then bend your left knee. So bend your left knee, and then use the heel of your left leg, push against the mattress. So it gives you some force to anchor and propel you toward the right side, right? And then at the same time, as you're bending your knee, and then you're pushing yourself toward the right side, you lift your buttock, so it will help you move better. And then as you're doing that, you're going to have your right leg straight. So your leg has to be straight when you're turning toward the right side. So your right leg straight, with your left knee bent, and now if you have the rail up, the rail of the bed, so you're going to grab the right rail with your left hand again, and then so you're going to push your heel against the bed as you're grabbing the right rail, so you push yourself toward the right side, right? And then so that's how you do it. Again, if you want to turn toward the left side, you will have your left leg straight, and then your right knee bent, and then with the heel push yourself against toward the left side, and then have your right hand grab the rail, and then turn at the same time. So it's very important that you turn every 2 hours when you're awake, from the back to one side and then to the other side, and alternate. So that will help you prevent any bed sore, and then help promote circulation also. So while you're in bed, does it make sense? Okay, now next we're going to teach you about leg exercise when you're in bed. So mostly you're going to be doing passive range of motion. So not too forcefully, just slow and steady exercise. And first, like I'm assuming this is my leg when you're laying in bed, so you're gonna rotate the ankle toward one direction or the other direction, like this. And then there's the ankle exercise, and then you can rotate your big toe in circular motion. So I'm assuming this is toward the end of the bed, so you're gonna rotate your toes. Do that 5 times, so in circular motion. And then you can move your feet, both feet, the same time. So your legs are straight. These are your feet, and then you can move your feet up and down like that. And when you're doing that, you can feel the calf muscle contract and relax alternately. You can repeat that for 5 times. Does it make sense? So he's doing it with his feet. That's good. Also, you should do when you're lying in bed. You can raise both feet the same time, and then when you're maybe even one leg at a time. If it's 2 feet, it's too much. And then while you have one leg straight, rise, and then as in the air, you can bend your knee like that, and then do that 5 times, right? And then now you can do the other leg. Raise your leg to the air, and then bend your knee. Do it 5 times. Okay. So that's very important. So when you're awake, you should do this leg exercise about once every 2 hours. Okay, so now you should coordinate to turning, leg exercise with diaphragmatic breathing, using the incentive spirometer, and then coughing exercise. Just rotate. I do this exercise first. Next, I do the other one throughout the times when you're awake after you're recovering from your surgery. So does it make sense? You think you can do it? Okay, so it's very important you do that to prevent deep vein thrombosis, or if you have any breathing problem also. And now here's the call light. If you need anything, please let us know. You can reach the call light. And do you feel okay right now? Okay, do you have any more questions? So he has no more questions, and then the call light is within reach, and the bed is at the low position, and he's comfortable, and he verbalized understanding of the teaching, and he demonstrating the return skills. So now I've completed my patient teaching, and also the families they understand it also. They feel like they can help the patient perform the exercise after the surgery. And then I'm going to perform hand hygiene again. I'm going to document the patient's response, and then the exercise that I taught, that he verbalized understanding. So I have reached the expected outcome of the teaching. Thank you.